Quick note. This is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Here's what Mayo Clinic and the NIH actually say about vitamin B12 deficiency testing. Many online tests only measure total B12, but research from the NIH shows that up to 25% of people with deficiency have normal total B12 levels. That means you could be told everything is fine when it's not. In this video, we'll cover the real cost, how the test works, and exactly how to order it online without a doctor visit in 2020. 6. Stick around. This could save you from a misdiagnosis. According to the Cleveland Clinic, vitamin B12 is essential for nerve function, red blood cell production, and DNA synthesis. Deficiency happens when your body doesn't get enough B12 from diet or can't absorb it properly. Medline Plus lists common symptoms like fatigue, weakness, constipation, and neurological issues like numbness or tingling. But here's the catch. Symptoms can be subtle or mimic other conditions. The only way to know for sure is a blood test. Let's talk about what that test actually measures. The test is a simple blood draw. A healthcare professional takes a sample from your arm and it's sent to a lab. Per the NIH, they typically measure total vitamin B12. But more advanced panels also include active B12, holotranscobalamin, or methylmalonic acid, MMA, for better accuracy. Mayo Clinic notes that MMA can be elevated early in deficiency, making it a more sensitive marker. You usually need to fast for 6 to 8 hours beforehand, but check with the lab you choose. Medline Plus lists the normal range for total B12 as roughly 200 to 900 pg/ml, but this varies by lab. If your results fall below 200 pg/ml, that's typically flagged as deficient. However, the NIH says borderline levels, 200 to 300 pg/ml, can still cause symptoms in some people. That's why doctors often order additional tests like MMA or homocysteine. Always discuss your numbers with a clinician. Don't self-diagnose. Prices vary widely. A basic total B12 test at a lab like Quest or LabCorp typically costs $29 to $50 out of pocket, according to the NIH's cost transparency data. More comprehensive panels, including MMA and homocysteine, can run $100 to $200. At a doctor's office, you may also pay an office visit fee. If you have insurance, copays and deductibles apply. The good news, direct-to-consumer online labs often have lower prices, and you can see upfront costs before ordering. As of 2026, most U.S. states allow you to order your own lab tests online, thanks to direct access testing laws. Sites like Walk-In Lab, Request a Test, and Private MD let you choose a B12 panel, pay online, and get a lab order. No doctor appointment needed. You then go to a nearby lab, often Quest or LabCorp, for the blood draw. According to the CDC, directly ordering your own tests is legal in nearly all states, but some require a physician's approval for certain panels. Look for providers that use CLIA-certified labs. That's a federal requirement for accuracy, per the CDC. Reputable companies show their lab partners on their websites. Our research in 2026 finds that Walk-In Lab and Request a Test are popular for B12 panels, with clear pricing and no hidden fees. They also offer phone support with a nurse if you have questions about your results. Always verify the company's accreditation and read recent reviews before paying. Just because your number is in the normal range doesn't mean you're fine, says the NIH. Some patients have symptoms at 350 pg/ml. That's why the NIH suggests a functional B12 deficiency might be more relevant, where the body can't use the B12 even if blood levels are normal. That requires testing MMA, or holotranscobalamin. We recommend ordering a panel that includes those if you have neurological symptoms. Again, take your results to a clinician for interpretation. Here's the bottom line. Based on research from Mayo Clinic and the NIH, B12 testing is cheap, easy, and can be done online without a doctor. But it's a screening tool, not a diagnosis. If your results come back low or borderline, see a doctor. Folic acid supplements can mask B12 deficiency, and treatment is usually simple: oral supplements or injections. Ordering your own test is fine for awareness, but don't skip the clinical follow-up. Ready to check your B12 levels? We've vetted the most affordable and reliable online lab providers for 2026. The links are in the description below. They offer same-day lab orders, results in 2 to 3 days, and CLIA certified partners. No doctor visit, no insurance needed. Just follow the link, pick your panel, and get tested. Remember, knowledge is power, but a doctor is the one who treats. And if there's another blood test you want us to break down, tell us in the comments.